All right, we're so happy when Dr. Zach Levine joins us from the MUHC. We're talking all things health. It's a new year, which means prosperity, good health, maybe, but also health threats. Thank you so much for joining us this morning.
Pleasure.
Okay, so we're going to talk about sort of what's still, I hate to use the word trending, but there's things to look out for this year globally. Yeah. We have to talk about this potential measles outbreak, right? Public health is warning about this woman who had the virus. Yeah. And potentially expose a bunch of people. Yeah. And the public health is not announcing, giving the names of the clinics, so there's no medical reason for them not to give out the names of these clinics.
I don't know why. Okay. The truth is, I don't know why they don't give it out.
Yeah.
I guess not to panic people who have been to those clinics.
Yeah, but let's talk about measles, and let's talk about this vaccine hesitancy or anti-vaxxers, as they're known.
That's the term.
So measles, by the way, let's be clear.
Yeah,
you
super
get a vaccine.
Infectious. Yeah. Yeah, you get a vaccine. It's recommended at, I believe here, it's 12 months and 18 months, and then basically you're immune for life. Right. It's awesome. And most of us benefit from the fact that most people are vaccinated. So
we built this fence, this defense
herd
system.
Immunity.
Yeah.
But the problem is, as you know and I know, there's all these outbreaks now because there's more and more people who are opting out of vaccines. And so those people aren't protected, and measles is super infectious, right? Much more infectious than the flu, for example.
And deadly for small children.
It can be, yeah. And even for not small children, a certain percentage of them get pneumonia, a certain percentage get encephalitis, a very serious infection around the brain, which can be deadly. So it's not a benign disease, and it's the sad thing is it's completely preventable, as are so many other things, including polio, which you mentioned. Most of us don't even, the problem is people don't remember when polio was a thing, you know, and people were dying and people were paralyzed and they couldn't breathe, right?
Yeah.
So we're all
the iron lung.
Yeah, exactly, the iron lung. And now we're like, well, we don't really know about that. And, you know, vaccines, what we know more is, we've heard vaccines cause autism or they cause other things.
Which isn't true.
Not true at all, exactly.
So you're saying this vaccine hesitancy, which is a polite way to say anti-vaxxers, is going to be a problem. And it's on the rise in 2019.
It's on the rise. There's more and more people not getting vaccinated. And we're seeing the results of that, which is diseases that are potentially deadly that could be completely prevented are back.
Okay, let's move on to the next one. So this is the antimicrobial or the antibiotic resistance. What does this mean exactly? Which means are we taking too many antibiotics and basically creating superbugs?
Yes, that's exactly it. So basically, it's not just us, by the way. We use antibiotics in animals as well. They use it in animals to prevent them from getting sick.
Presumably the animals were eating, right? So this is...
Yeah, exactly. So it affects us. And generally, the bugs are getting more resistant. So the one thing to know, and I think more and more people understand, is you don't want to take an antibiotic if you don't need it. So if you have a virus, if you have a cold, if you have the flu, you don't need an antibiotic. And in fact, you're potentially doing harm. Again, we don't remember the times when we didn't have before the 40s, there were no antibiotics. So people would die of these bacterial infections. We don't
I think people
that.
have the instinct of like, oh, I finally got an appointment with my doctor. I'm just going to, I don't want to wait another month before I see him or her.
I do understand.
So just give me the antibiotic.
Or they wait 12 hours in the emergency department.
Exactly. Just give me something.
Only to be told, oh, your body's going to take care of it. You know, what they wait for.
Yeah. You're also talking about something called weak primary health care, which does this mean a lack of access? What are we talking about?
Yeah. So, I mean, they talk about, this is all from the World Health Organization, by the way, and the link, you can find the link online. But basically, they're saying that a lot of people don't have access to a doctor. And they're talking about, third world countries, etc. But even here,
I just gave you the stink eye and the camera stink eye because there was a huge problem with a shortage of doctors here.
And they've actually done studies, even in the first world, not having a family doctor translates into a lower, basically a lower length of life.
Life expectancy.
Thank you for the right word.
They pay me to find the right words. Okay, let's talk about the non-communicable diseases, heart disease, cancer, diabetes. Still, we're nowhere near sort of eradicating or finding the big solutions for this in the next year.
70% of people die from those things. And, some of them we can't prevent, but to a certain extent, those are lifestyle diseases too. Number one by far is smoking, right? So all those things, a stroke, heart attack, and cancer are all related to
the
smoking.
Cigarette.
And then all the things we always talk about and people get bored of, but they're true, is diet and exercise. The lifestyle things. If you have a healthy lifestyle, you're preventing a lot of these non-communicable diseases.
If you don't have a doctor, you should just start working out and eating well and stop smoking. Sort of counteract.
Exactly. Go see find a doctor.
Exactly. We've run out of time, but very quickly, we've got air pollution is going to be a big problem. HIV still significant in younger people now because
Absolutely.
speaking of they don't remember a time when
It used to be.
exactly
Everyone died from it in the past.
Ebola, a problem, of course, not
Yeah.
here, thankfully. And influenza, by the way. So the flu shot, the importance of is it too late to get a flu shot?
It's not too late.
Okay.
Never too late, so get it. I think it's pretty good this year. I don't know the exact numbers, but it's definitely better than not getting it.
All right. Dr. Zach Levine, by the way, all this information we're going to put up in our show notes. Thank you so much for joining us from the NBUHC. Dr. Zach Levine, always a pleasure. Stay tuned. You're watching Breakfast Television on City TV.